All right, so that's a massive problem that we're seeing in some parts of the continent, certainly here in South Africa, Kenya, we've seen it, and a number of other countries as well. And to discuss the depth and the impact of the corruption in the fight against COVID-19, we're now joined from Kenya by Wanjeri Nderu, who's a human rights defender and communications consultant. We also have Kwame Gonza, who's an advocate for United Africa now, and also Denise Koda, who is the president of the African Union Economic, Social and Cultural Council. To all of you, thanks very much indeed for joining us and welcome to the program.
Thank you, Peter.
All right, so perhaps let me start with you then, Kwame. You're in Ghana, in the north of the country, and I just want to get a sense how things have played out there in terms of corruption and corrupt activities around COVID-19 procurement.
Thank you, Peter. The situation in Ghana is that at least there has been some reported theft of especially the PPE, if you look at the situation, the country went and got the IMF loan of around $1 billion, which was the COVID relief fund. And up to now, the accountability is wanting. It is some situation which you cannot say that it is well with the people. But I would like not so much to simplify things, but I would like us to look back into history. When you look back into history, you can see that since slavery and colonialism, there is this group of people who has been benefiting from the agony of the few. There is some group of people who are few and they have been benefiting and conniving with the external forces and robbing the other Africans of their right to health, right to live, right to economics. And I think the Africans themselves have to rise up and come together and work together to solve this problem.
All right, so what you're saying is that this has been a long-standing culture and it just has continued into COVID-19. Let's go to Kenya now, and where we find Wanjeri. And Wanjeri, I know that you started a lot of activism in this arena. Hashtag arrest COVID-19 thieves, one of your handles. Just how bad did it get in Kenya?
It got really bad. Because they're used to getting away with it all the time. They just use this as an opportunity to steal from us. And what we have seen in this country is that currently, as we speak, our doctors are on strike because they've lost some of their colleagues to COVID, and they are not getting any protective gear. And the gear that they're getting that is government issued, that is at times mostly locally manufactured, is below par in terms of standards. So we are finding that even our own medics, the people who are supposed to be taking care of us, are also dying from COVID-19 related complications. And we are having also some of the doctors getting quarantined because they have come to treat patients and they're treating patients with the PPEs that are not effective. So we have gotten donations from Jack Ma, for instance, and they were brought to Kenya and they were disappeared and sold by private contractors to private hospitals, and also sold to even individuals who are then selling them to the public who can afford. We have cases in Kenya where people in government and high places of power are buying their own ICU beds and placing placing them in their homes. So it's not about the common person here. It's about how much money can they make from it? How much money can they steal? How much of the donations can they keep to themselves? Getting to an extent of them putting ICU beds in their homes for themselves and their families is where we have gotten to as a country.
We'll talk a little bit more about where the systems fail, because I find often in times of emergency, procurement procedures are overrun. But let me ask you, Mr. Koda, you're looking at the continent in its totality. We've seen Ghana, we've seen Kenya, we know South Africa is a problem. What about the rest of the continent? I hear that there's some other countries. Is it widespread or is it limited to a few countries?
Thank you very much. First of all, good evening, viewers. And also, thank you very much for this opportunity to talk about this very serious issue. What we are seeing in Africa is an indication of the level that corruption has gone to. And it's very unfortunate, it's very sad when people steal money for the sick, like what's happening in Kenya, where I come from, in Ghana and many other countries. They're stealing money which belongs to people who are dying, stealing money. Sometimes we had cases where people even stole money for cemeteries, where cemeteries were supposed to be built for the dead. And this tells you how much eroded we are as a continent in terms of corruption. And I'm glad that the African Union is very concerned and committed to this, in the sense that we have an advisory committee which looks into various ways through which corruption can be eradicated in Africa. Now, to answer your point, this is a widespread. You can't single out just these few countries. These few countries have come out because the media has highlighted what's going on. But I think there's a lot of other issues, other countries which we are also experiencing the same. And it's very sad that when you are rich and you pronounce yourself rich, but you're rich from money which belongs to people, to poor people, to sick people, to dead people. This is something that Africa really needs to look at. And I'm also, would like to say this at this juncture, that corruption is a disease that we must fight. Corruption has ruined institutions. Corruption is ruining, our continent, and corruption has retarded development. Nobody wants to invest in a continent or in a country where corruption is rampant the way it is in Africa. So it's a disease that we really have to find a way of dealing with. And what we are seeing in the COVID funds is just an indication of how rotten our society has become in the continent. And I think it's something that we really have to work out very strongly to find ways, and also our leaders at the continental level, to find ways to deal with.
Let me ask you, Kwame, a lot of this corruption can't happen without patronage and without assistance from people quite high up in the system. How high does it go in Ghana? And then, Jerry, if you could answer that as well.
Peter, when the money was registered, it came in. For example, I will give you some of the figures I was looking at on Friday. You can see that South Africa received about $4.5 billion. Kenya received $0.75 billion. Ghana received $1 billion. But immediately the money was reported that it has come to Ghana. The Auditor General was immediately forced on leave by the sitting president. So you can see that it is no good. It is no good, Peter. And the Africans, we have to come together. And that is where I really thank people like Dr. Charles Sinkala of Africa 55 States, because he has come out to call the Africans to work together and try to bring all these things to light, to come out and work together as civil society, as Africans, so that the Africans in South Africa can be concerned about what is happening in Kenya. The Africans in Kenya can be concerned about what is happening in Ghana. The Africans in Ghana can be concerned about what is happening in Mali, what is happening in Ivory Coast, what is happening. This is how we need to start working. We need to stop isolating ourselves, and we come together and then we will attack this problem as a union, as a united people, as Africans, because it's like sometimes we are isolated and they are attacking us from these small countries. So we have to come together and put our hands together and attack corruption all together as Africans.
All right. Jerry, how high does it go up the system in Kenya? Because, like I said, there's no way that it can't be enabled by people with authority.
In Kenya, it goes as high as you can imagine. We have people in the president's family implicated in the theft. of the COVID-19 resources. You know, we have people directly linked to him by blood mentioned in the allegations that, you know, they have been a part of the people who are stealing from us. Now, but one thing, I like what Kwame says about us uniting as Africans, but we cannot unite if we do not make the language our own. We have this use of the word corruption. Personally, I don't use the word corruption. I use the word theft, because we as an African people dealt very, very viciously with anybody in our cultures who was considered a thief. Okay? But we are not dealing with these people as thieves, because we are using a language that the common person does not understand. So the people who are affected directly, who are us, affected directly by this theft, cannot be able to relate our current struggles and our pain, and the fact that we are maybe one hospital bill away from you know, bankruptcy for those who consider themselves middle class, or even that poor person down on the ground who has to feed themselves on only 1 meal a day, are unable to connect the theft of their money and their resources to their suffering, because our language is not only to elite, it is also foreign. I have asked so many people in my country, Kenya. We have over 47 tribes. And I asked them, what is corruption in your language, in your common mother tongue? What is corruption? I come from the Kikuyu community, for instance. As a person from the Kikuyu community, I should not be speaking about these issues because our president comes from my community. But even if I ask the people from my community, what is corruption in our language? We really don't have it. But everybody understands who a thief is. Everybody understands what theft is. We need to start using language that we can understand, that the people in our communities can understand, so they relate that the theft that we are experiencing from these people and they're getting away with it is a matter of life and death for us. So as we are uniting as Africans, we also need to think, how do we talk a language where our people understand what we are saying? And when I use the word thieves, the first time it hit me that maybe we're not communicating was in 2018 when I started the Stop These Thieves hashtag. The Stop These Thieves hashtag, I used it to get people to the streets, and we protested against the theft that was going on at that time. And that is why even this time when I started the Arrest COVID-19 Thieves, it was very deliberate that I called them thieves, because we will understand who a thief is. They're stealing our life, they're stealing our children's future, they're stealing everything we call our own. But language is what we are missing here. It's not that people don't understand what is happening, but how do we educate them and communicate in a way that they feel that the reason why that person died is because of the theft that we're experiencing in this government. And also what we're experiencing in Kenya is these numbers. Suddenly, after we did the protests on Arrest COVID-19 Thieves, after it was exposed on TV, the numbers have suddenly gone down. Suddenly, we don't have deaths. I mean, you come from 500 deaths one night, the following day, there are 40 deaths. It doesn't make any sense. So even Kenyans themselves, we were threatened into action. We were threatened into putting all these measures that if you don't do this, we had police brutality. We had over 100 people killed in the first about 1.5 months by police for being found out after curfew. So it has been used as a way of not only oppressing us, but also benefiting a few elites who have access to these resources, you know, and they're still getting away with it because Kenyans don't get, we need to get Kenyans to get it, and Africa at large.
All right, so the language that's used is very, very important to agitate people towards action. We're going to take a quick break, and when we come back, Mr. Kodo, I'm going to ask you why the African Union as a continental body isn't sitting on member countries to manage this problem. Stay with us.